Hi, the key component to neck pain is excessive contracture of the upper trapezius. Now the traps are formed by the upper, middle, and lower part, but in the upper portion, these are the parts of the insertion that attaches underneath the skull. When those traps start to squeeze, they shorten and they'll elevate the shoulder because where the muscle attaches and where it originates, they'll come closer together. So this is kind of what you'll have. Many people out there are walking around with tight traps and don't even know it. They look at the mirror, they may notice the shoulders a little bit elevated, but they just kind of ignore it because there's no pain. But there's a lot to understand about traps, and I want to go over the key components to it and how you can get these traps to relax, which will take away a lot of your neck pain. A lot of people out there who have herniated disc problems, spondylosis, degenerative joint disease, osteoarthritis. The key component here, excessive traps, will induce that and bring out more pain and problems from the underlying pathologies that you have. So even though you may take an MRI and the MRI shows a herniation, they're going to say, boom, let's remove the herniation. But most of the time, it's not coming from that. It's coming from these extra muscular components outside of the spinal cord that's causing a lot of this inflammation and irritation. Now, the first tip is being in line and checking these traps intermittently throughout the day. So I want you to have an awareness, because the trap muscle, when you look at your shoulder, the shoulder should be in line with the collarbone. That if your shoulder is higher up than the collarbone, that means the trap muscle is contracting because it is pulling upwards from where it's originating behind the skull. So the key thing, what I'd like you to do is just be aware that where your traps are all the time. What you can do is you can actually shrug them up and hold it for 2-3 seconds and let them go. So you can get the feeling of what the trap feels like when it's contracted, and then when you let it go, just let them fall down. But remember, it's important to jut the chin in, keep the ears in line with the shoulders as well, because if your head is forward, you're going to cause those traps to overwork as well because they have to hold the head backwards. Remember that the head weighs 12 pounds. For every inch you go forward, an additional 10 pounds. So 3 inches forward is 42 pounds of stress that the head, that the weight has to actually be sustained and held back from those upper trap muscles and the other muscles around it. The second component to this is get in the habit of doing shoulder shrugs. Just not lifting the shoulder up, but shrugging and rolling backwards. As you roll backwards, what you're doing is you're isolating those rhomboid muscles under the middle trapezius. Now the upper trapezius is sitting right above the middle trapezius, but the middle trapezius sits over the top of the rhomboid muscles. The rhomboid muscles is what attaches the spine to the inside of the scapula or the shoulder blade. And those are the muscles that will bring your shoulders back. So when you're spending time forward with that forward head posture, rounded shoulders, those traps have to work harder, but by kicking in those rhomboid muscles, by just doing light shoulder shrugs and going backwards, you're going to kick in and isolate those rhomboid muscles to help strengthen it. Actually it will help what we call retraction of the shoulders, which will help posture and reduce a lot of pain and inflammation. Now the third component is making sure you're stretching the traps regularly throughout the day. Very simple. You grab over the head, pull over to the side, and hold it 15-20 seconds. You can actually keep pulling until you feel that real tight sensation. Turn your head up a little bit and look up, and then you can pull downward and forward. Then you can turn all the way over, and then you can actually pull forward. Okay? But don't be afraid to pull the neck. Start out gently. Don't just tug on the neck, because when the muscles are real contracted, you don't want to be a hero. It takes time for muscles to stretch, and gradually do that little by little over the course of time. You're going to see a lot of looseness, and you're going to feel that contracture of the trapezius start to ease up tremendously, which will ease up a lot of that pain and inflammation that you're having. So in summary, you have to look at your ergonomics, the things that you do day after day, how your forward head posture is. Look at the things that you're lifting, maybe at work, at home. People who are in the gym, specific activities of doing abductors, shoulder abductors, doing shrugs this way, doing over the head exercises. Those things will overdevelop the trap, and understand that if those traps continue to become overcontracted, they will continue to inflame and develop myofascial problems. Those are particular areas within the fascia, within the tissue, that would start to adhere like glue. And as that happens, we start getting a whole bunch of other conditions that follow this referred pain, because as the traps start to contract, the body will then send up the spinal system to different areas of the body pain, sensation, tingling, numbness. You can get headaches behind the skull, can affect your eyes. You can get pain down the arm, down the shoulder blade, into the chest. The body is a very delicate structure. So be in tune with your body all the time. Realize those upper traps cannot stay over contracted, or they're otherwise going to give you a lot of problems. Make it a great day. I'm Dr. Alan Mandell.